homeschooling, just starting off. One of my boys, Alex is 8, he's grade 2, like many kids, they're doing it pretty tough. My grade 5, he's doing it pretty tough as well, very tough. Homeschooling, home learning, whatever you want to call it, but it is pretty tough. One of the things I want the government to do straight away is make some regulatory changes to free up trainee psychologists. There's around 2,000 of them in Victoria, to get them available for kids in these situations. It's not hard and it's not a big deal. We're asking the government to do it because it's the right thing by our children. They are suffering a lot under homeschooling. We're asking them to do this. If they don't do it in 14 months' time and we win the election, we'll do it straight away. It's a very straightforward and easy way to get many people, up to 2,000 around the state, to be able to participate in helping kids during lockdown and during home learning. Now, clearly, I don't want to see home learning and any of this stuff go on forever, and I've made that pretty clear. But what I do want to see is solutions to their mental health, kids' mental health, because we all know, whether you've got kids or not, I think everyone knows that that is a big problem at the moment, and we've got to do more than just talk about solving these matters. And we can do more than talk. Here's a way, sensible way, common sense, not political, straightforward, to get these people active to help our kids, because I can tell you firsthand, a lot of kids need a bit of help. I'm going to get Emma to talk a bit more some details. She's the Shadow for Mental Health. Can still be that. And she's really good at it. Here's why.
Thank you. Thank you very much. Like so many other parents, I've seen firsthand what it's like to be homeschooling a child and to see the pressure that they're under, whether it's through the isolation of being away from their mates, even out of that competitive classroom environment of helping, I guess, get those rewards to keep them motivated. We're seeing less and less of that in the classroom, and the problem around that is that most parents now who are supervising their kids who are supposed to be learning at home are actually watching their kids having meltdowns. They're watching them cry, lying face down on the trampoline. They're watching them burst into tears during the Google Meet and meeting with their other classmates, and asking their parents, why are we not going to school anymore? Particularly for the younger students, the prep students, they don't even understand what school really is. And the Andrews Labor government haven't addressed that. We haven't seen an immediate fix and provision of any additional workforce to support our children's mental health. We hear about mental health reforms through the Royal Commission's recommendations, but they're recommendations that are only going to come into play in 2 or 3 years. It's simply too long for our kids to wait for a fix and to wait for mental health support. There are simple things that are available to this government, but they've simply neglected to do that. They've neglected to support our kids' mental health, and we're coming up with solutions because we know there is a better way. We know that there can be a plan to support our kids' mental health. Today, we're going to support the calls of the Australian Association of Psychologists to immediate release trainee psychologists into the workforce so that they can support the mental health of our children, to make sure that the trauma that our kids are going through today can be minimised and that this doesn't cause long-lasting harm that hurts a generation of Victorians and the future leaders of this state. We need to always put the mental health of our children first, but we've got a lot of work to do. We need to rebuild our children's future. We need to do that through making sure we've got supports for them in their mental health and wellbeing, and then we immediately release trainee psychologists into our schools to support our brightest and our youngest and our future in Victoria, because they've been forgotten for far too long.
I guess maybe on the trainee psychologist, work my way backwards. That's a requirement for the Commonwealth to do that through Medicare, is that right? Have you reached out to the federal government to support that with the association?
Yeah, we'll certainly be doing that very shortly, Rich. The Australian Association of Psychologists have been very strong about wanting to unlock their potential. They've come forward to the government with this idea that they can actually release almost 2,000 people in Victoria immediately into Victoria's mental health workforce. We know there's been an enormous surge of demand on Victoria's mental health system, which was already broken and in crisis, and now our existing workforce is fatigued. They're feeling like they're losing hope themselves. They need a break, and while there's continuing uncertainty about lockdowns and restrictions and what happens next, they're only going to be more tired and unable to do their job. We need this urgent demand met. We need to make sure we see a surge into the mental health workforce. This is a quick and easy way that we can do it, and we'd have people up and running by tomorrow if we had approval around it.
How long does it take to train someone for a role like that, though? Could you actually get that many people in straight away?
So I've spoken to the Australian Association of Psychologists this morning. The association say there are 2,000 people in Victoria who would be willing and ready and able to provide the mental health support that our young people need. Tegan Carrison's the CEO. She's a fantastic advocate to support youth mental health and make sure the supports are there, and she can certainly see this as a solution going forward. We've got kids who are in crisis. They're locked out of their schools, they're locked away from their friends and family, and they need mental health support. Let's release these end-stage trainee psychologists to give the kids the mental health that they need from today.
Why is it important that mental health specialists are in schools rather than, say, social workers or nurses?
Well, it all adds to...
Just shuffle forward a bit so we get the light off your face. Otherwise you're going to look...
I'm going to hit the microphones, but
That's okay.
Thank you.
We'll
Thanks.
shuffle them forward if need be.
Yeah.
Thank you.
Thank you.
So yeah, why nurses
Yes.
and social workers aren't enough?
Well, it's all part of the problem in that we've got a massive shortage in our mental health workforce at the moment. For areas which are perhaps further from Melbourne, there may not be a social worker in that town. There may not be a nurse that specialises in mental health. And so we need to embrace every single element of the available mental health workforce. We're facing a crisis at the moment, and it's through government policy that's locked kids out of their schools. They've locked them away from their friends and family, away from their sports and regular activities they can use to look after their mental health. We need to find that surge capacity in the mental health workforce, and we can do that by releasing trainee psychologists to provide support to our youngest Victorians.
And kids are resilient though, so do you think that will be enough to lift their spirits after what they've been through? It's not like it's going to be a prolonged issue per se?
There's no doubt kids are resilient, but they're not just disposable and to put at risk that, just because you can get COVID and you might transmit COVID, that we can throw away their education, that we can just dismiss that their mental health concerns aren't something that's worth worrying about today, because it is a problem today. It's of immediate harm. We can't ignore that. We've got a workforce and psychologists who are ready and able to go. They should be released today, and that's what the Andrews government should be doing, not planning for something else 2 years down the track, because by then it'll be just too late.
What about other support services? Patrick Victorian has obviously said that he's talked about the mental health toll and need to allocate more funding in all areas of the mental health area. Should we bring forward recommendations from the Royal Commission?
The Royal Commission have got a strong framework around and time frame over when the recommendations should be implemented and what should be prioritised. I'm certainly working with all of the relevant groups in the mental health workforce to make sure that because of this pandemic that we're prioritising our funding and our opportunities to grow the mental health workforce and to support them to best do their job and to support the mental health of Victorians as soon as possible. This pandemic is more than just COVID. It's a shadow pandemic that's harming mental health of every single Victorian in different ways. It's not just our kids that are turning up to emergency departments after self-harm and suicidal behaviours. It's kids who are at home and suffering and throwing tantrums, changing their behaviour, withdrawing from their own families and not knowing what happens next because they don't know when school will go back. That's who we need to look after, and we need that immediate injection of workforce, and we can do that by releasing trainee psychologists from today.
Does the party then support the mental health levy to help fund all that?
The mental health levy is separate, in my view, to how we reform the mental health system in Victoria. If we look at the waste of this government, there's $3.7 billion in the Metro Tunnel project alone, which has been simply wasted. Every single taxpayer dollar that comes to this government should be put towards services and assets that actually make a difference. It shouldn't just be put in a bottom line that's just gone to waste. $3.7 billion of waste from this government, which could fund the $3.8 billion that they have put towards mental health in this state. I know where we would put our money. We would not put it towards waste. We would put it towards investing in the Victorians' mental health.
Thank you.
Thanks, guys.